Gliquidone is a sulfonylurea drug used in the management of diabetes mellitus type 2. In this video, let's found. What is Gliquidone? What is Gliquidone used for? Contraindication. What are the side effects of taking Gliquidone? How does Gliquidone work? How to use Gliquidone. What is Gliquidone? Gliquidone is an antidiabetic medication in the sulfonylurea class. It is classified as a second-generation sulfonylurea. It is used in the treatment of diabetes mellitus type 2. It is marketed by the pharmaceutical company Boehringer Ingelheim. What is Gliquidone used for? Used in the treatment of diabetes mellitus type 2. Contraindication. Gliquidone is contraindicated in patients with allergy to sulfonylureas or sulfonamides, diabetes mellitus type 1, diabetic ketoacidosis, patients that underwent removal of the pancreas, acute porphyria, severe liver disease accompanying with liver insufficiency, several conditions, example, infectious diseases or major surgical intervention, when insulin administration is required, pregnancy or breastfeeding. Side effects. The main side effect is hypoglycemia, which may occur 4 hours after a meal and usually indicates overdosage. Mild adverse reactions include gastrointestinal effects, nausea, vomiting, heartburn, sense of pressure or repletion in the epigastrium, and diarrhea. Pharmacodynamic. Gliquidone is an antidiabetic drug in the sulfonylurea class. In patients with diabetes mellitus, there is a deficiency or absence of a hormone manufactured by the pancreas called insulin. Insulin is the main hormone responsible for the control of sugar in the blood. Gliquidone antidiabetic medication, which is used in those patients with adult maturity onset or non-insulin dependent diabetes, NIDM. It works by lowering blood sugar levels by stimulating the production and release of insulin from the pancreas. It also promotes the movement of sugar from the blood into the cells in the body which need mechanism of action. The mechanism of action of Gliquidone in lowering blood glucose appears to be dependent on stimulating the release of insulin from functioning pancreatic beta cells and increasing sensitivity of peripheral tissues to insulin. Gliquidone likely binds to ADP-sensitive potassium channel receptors on the panc cell surface, reducing potassium conductance and causing depolarization of the membrane. Membrane depolarization stimulates calcium ion influx through voltage-sensitive calcium channels. This increase in intracellular calcium ion concentration induces the secretion of insulin. Half-life. The mean terminal half-life was approximately 8 hours, range 5.7 to 9.4 hours. Dose. Type 2 diabetes mellitus. Gliquidone should be taken up to 30 minutes before a meal. Most patients respond to a dose of 45 to 60 milligrams, given in 2 to 3 daily doses. Safety advice. Pregnancy, contraindication. That's all the information about Gliquidone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.